got me on the phone and had me talk to this doctor. And doctor was actually friends with, is it okay if I say his name? The guy, you know, that does, the famous guy that makes books. Is that all right? He's good friends with Agustin, is that? Yeah, who wrote the South Beach Diet. So he obviously has been around people that have been in this industry before. And we talked and we had an initial conversation. And then Dominic and JC and some of the other members, Dr. Ricky Martini were there. We did a Super Saturday down in Fort Lauderdale, and I got an opportunity to meet this gentleman. He was just getting started. Now that was in December. Mm-hmm. And it's what? March. Or April. It's April, but it was March. Yeah. So that was basically, and he went from nowhere to everywhere like overnight. And so I'm impressed. He's a top cardiologist in the region.
That's exactly, you know, Dr. A, the first time I met Dr. Krichmar, he's down in my organization tonight.
That's a good thing.
So, you know,
that's a very good thing.
What we know is our organization is growing when you don't even know the globals in your group. So,
well, you're going to know him after tonight. Yes, Dr. Perry Krichmar.
First of all, I would like to thank Dom and JC for nominating me for Team Global. It's an honor and a privilege to be here. Thank you. Thank you. I would also like to thank my daughter Cheryl for accompanying me here tonight to see the old man at work. She's never done that before, so that's an honor for me too. Thank you. So I have a 20-year history that I have to give you in 5 to 7 minutes. So I'm going to show you how this program has impacted me, changed my life, and changed the lives of many of my patients in a very, very short time. For the first 15 years of my practice, I was doing general cardiology. And general cardiology, patients come in, you give them medication. They're overweight, you treat them with hypertension, cholesterol drugs. They come in for bypass. They have chest pain, you send them for bypass. And the family doesn't know how to thank you because you think that you saved their lives. Whether you do an angioplasty on them. I don't do them because I diagnose them. But the question is, are you really helping that patient? What you guys have to understand, and what you're all doing here today, is you're changing lives. When you do bypass surgery, or you do angioplasty, you're just treating the patients. You're not preventing anything. For instance, if you have high blood pressure, and you have high cholesterol, and you're a diabetic, and you're 100 pounds overweight, and you go for that surgery, but you don't change anything about your life, within a short amount of time, it's going to happen again. So therefore, I wasn't fulfilled as a cardiologist for those first. I started to feel that, what am I missing here? There was something that I was missing about what I was doing. So about 5 to 6 years ago, I decided, I'm going to do prevention. And that's when my life changed. Because I knew that there was more to it than just giving pills, telling people you have to lose weight, but there was no follow-through. There was nothing I can reach out and grab. I was looking now to change their lives. Well, now I'm on my journey. I'm seeking the Holy Grail. So, as Dr. A said, I started that search. Well, in order to do that, we all know that heart disease is the #1 killer of both men and women in the United States. If you add it up 2 through 10, it doesn't equal #1. So what are the major risk factors for heart disease? High blood pressure, high cholesterol, family history, smoking, diabetes is a risk equivalent. Well, you can't change your family history, and smoking we don't deal with. You have to stop. But the other risk factors I mentioned, you guys are all dealing with. You are working as preventive cardiologists in your business. This is what you guys talk about. This is what I talk about all day. And what's the common denominator of those illnesses? Obesity. So I knew in order to solve this problem, I had to have a weight loss program in my office. So I hired a dietitian. And I was partners with Dr. Agatston. And in myself, I wanted to lose weight. I wasn't really overweight, but I wanted to lose 10 or 15 pounds. I wanted to go down to my high school weight. So I went on the South Beach diet, lost weight, gained it back. And Dr. A said something that I heard him speak, and he said, all these diets don't work. You lose weight, but you gain it back. My partner that I'm partners with for 20 years now wrote the reality diet. I don't know, my partners like to write books. I don't know what it is. I haven't written a book. And I put 5,000 people on the reality diet. Great concept, fiber, had people lose weight, but 75 to 80% of the people gain it back. Then I was introduced about 5 months ago, 6 months ago, to Take Shape for Life. And it changed my life. So that 10 to 15 pounds I was trying to lose for the last 10 or 15 years, 3 weeks, gone. I found the Holy Grail. You guys are sitting on the Holy Grail. It's here. It's in your backyard. You got to use it. So I convinced my dietitian. We started using it. And for the first time in my practice, I have taken off more medications, have reduced medications in the last 4 to 5 months than I've done in the last 15 years. In closing, we are in a healthcare crisis. There's no doubt about it. Cardiologists specifically have been hit very, very hard this year. Our revenues have been hit 40% since January. This is before Obama healthcare. This just started. So there's not one cardiologist in this country who has not been affected. 50% of the cardiology practices as we know today will be gone this year. 50%. They will either be retired, merged with other groups, or bought up by hospitals. I didn't hear. I'm sorry. So this is a time you guys can go out and help people. You can help the cardiologists, the medical community. They are in dire need right now. If there's ever a time when you can go out and reach out to doctors, now it's your time. Remember, you're sitting on the Holy Grail. Thank you.
Dr. Barry Krichmar. Great job. Great job.
Thank you so much. Thank you.